Hey guys, injury experts, Dr. Morse. So unfortunately, a huge injury for the Philadelphia Eagles, Nakobe Dean, diagnosed and confirmed today with a torn patellar tendon. This is a significant injury. I'm going to walk you through the anatomy here, give you some recent examples, and give you kind of an idea of what to expect for him in 2025 season and when he potentially can return to what we would expect to be his baseline. So this is not a common injury. It used to be a death knell to NFL players, meaning they pretty much never came back from this injury. That has significantly changed. But the question becomes, do they ever get back to their baseline or pre-injury? And, we've seen at least 3 or 4 that come to mind this year. For some reason, 3 of them all happened on the Cincinnati Bengals. You had Deontay Smith, who's an offensive tackle. That's usually where they happen, a lot of the linemen. Then you had Chris Evans, who's actually a running back. And then eventually Trent Brown actually also suffered one. I wouldn't be surprised if there was more that I may have missed on different teams. But then we just heard about Nakobe Dean's from yesterday. Now, in terms of anatomy, think of the patellar tendon as attaching to the kneecap or the patella and then to the shin. This is essentially playing tug of war. It's basically a pulley from here to here. So whenever you move your leg, it constantly pulls. And you can see how that would be super important if you have a full thickness tear here. Now, the problem with this is when you're doing an ACL reconstruction, you're coming back from an ACL, you want to fire the squad as soon as possible. With a patellar tendon repair, it's the opposite. You do not want to fire it as soon as possible, and that has a tendency to slow down the recovery. Now, depending on who you ask, the data shows you can come back in 6 months, but sometimes it's closer to 12 months. Now, I do expect him to have surgery within this next week, and assuming there's no other injuries in the knee, I expect him to start the season on the PUP list. Now, the problem with these is they are frustrating injuries. They're very slow injuries, and they're hard to be explosive, which is not what you want to see with a guy like this. Now, let me give you some examples of other guys that have come back from this. One that you Eagles fans may remember is Brandon Graham. There's also Lucas Niang, J.C. Jackson, and Gerard Mayo, the former Patriots head coach and player. With that being said, the data seems to show that if he does come back next season in 2025, he's probably not going to be 100% post-surgery ideal stats until probably 2 to 3 years after this. It's kind of a big deal. So these are a bad injury. It's an unfortunate injury, a very frustrating injury, significant surgery. Although Brandon Graham, just for comparison, he also had a torn ACL, so he had a little bit extra. But in general, these are frustrating injuries. Hopefully that was helpful. I traditionally do not do defensive player breakdowns, but I figure this was a big name and not a super big common injury, so one that was worthy of covering. If you find this fascinating, do me a favor, smash a thumbs up, subscribe, and check out some of the other content here at the Injury Experts. Thank you very much.